Thank you everyone for being here today and taking the space and time to join in these conversations, which, as we've talked about before, are often difficult to have, but so important. Before I begin, I would like to dedicate my voice today to my grandfather's sister, who was my great aunt Linda. She was found murdered in Anchorage in July of 1973. And her case to this day remains a cold case file in Alaska. I'd also like to dedicate my voice to the many Indigenous youth whose lives were taken while they received services at Covenant House. They are dearly missed by their families and communities, as well as grieved by the staff and youth at Covenant House who knew them and loved them. So again, thank you for being here. My name is Josie Heyano. My parents are David and Nina Heyano of Tanana and Ecock, Alaska. My paternal grandparents are the late Pete and Rosa Heyano of Ecock, and my maternal grandparents are Alfred Miller of Anvik and Mary Starr and the late Paul Starr of Tanana. For the past few years, I have worked in direct care with youth experiencing homelessness. I worked both at the Door in Fairbanks and Covenant House in Anchorage. Most recently, I've had the opportunity to participate in building a trafficking response program at Covenant House. This is a really exciting opportunity, but what I learned really quickly in this role was that, like all of the youth who seek shelter at Covenant House, our caseloads of youth that had been trafficked were also disproportionately Alaska Native. Right away, we saw that our caseloads were full of Alaska Native youth, all under the age of 25, many who had been intentionally targeted, manipulated, and forced into exploitation. I wish I could say that all of these youth were still with us and alive today. But at places like Covenant House, we know all too well the realities of missing and murdered Indigenous youth within our state. So I learned quickly that the issue of human trafficking is woven into the experience of missing and murdered relatives here. While these young people shared with us their experiences in trafficking, they also shared similar experiences that happened long before they came to experience exploitation. Their stories intersected each other in recounting historical trauma, domestic violence, loss of culture, interactions with systems like OCS and DJJ, separation from their families and communities, substance abuse, poor school attendance, poverty, childhood abuse, sexual assault, and there were so many more. It's because of these reoccurring themes that I got really motivated to turn these stories into data and to use these narratives so that the youth who so bravely share with us can help us to understand where interventions can happen and where upstream prevention is needed. And the way that these things sometimes happen, I actually had been having this exact conversation with a colleague at the FBI while I was working at Covenant House. And she happened to tell me about a former FBI analyst who was attempting to do literally exactly what I was describing. So that's how I came to meet Kristen Harris at Prevention Now. I remember giving her a call, or actually just emailing her, a cold email out of the blue, and she responded right away. We had one phone call together where we just intensely meshed on what was driving us, our passions, the patterns we were seeing, and the need for this work. So I guess fast forward about like 9 months now, Kristen, and I've just completed my MSW, which included a practicum fellowship with Prevention Now. And I've had the opportunity to help Kristen build relationship with the communities that are so important to me. And so it's a little bit who I am, why this work is important to me, and how I got connected with Kristen. Just as I'm incredibly passionate about these issues in Alaska, Kristen has the same fire for building collaboration and using data in different ways, but to prevent exploitation, especially. So thank you. Kristen, you want to take it away?
Yes, thank you so much for sharing, Josie, about both Prevention Now. We have Prevention Now's origin story and our origin story as well. And I'm so grateful for that, that email that you sent me 9 months ago. So I'm going to explain a little bit more about how Prevention Now uses data or wants to use data to help prevent human trafficking. And then Josie and I are going to share about what that has looked like in the last 2 or 3 months in Alaska. And I also, would like to share that we are such a new organization that Alaska is actually one of the first places that we're really working. And a large reason why we chose to work with Alaska first was just the warm welcome and the amazing work that is already occurring there, which I'll also talk about later. But I just wanted to, before we move forward, wanted to call that out. So data collaboration and prevention. Prevention Now wants to leverage data to uncover why human trafficking occurs, and who is most at risk, so that we can use that information with our local partners to develop preventative efforts, as Josie and I have both said, to stop trafficking before it starts. How far upstream, we talk about it as a river sometimes, how far upstream before that event or that exploitation occurs can we help bring in protective and supportive factors for individuals, for communities, potentially even at the society level. Our model is fairly simple. It is about building partnerships with communities. It's about using data in some hopefully new and innovative ways that, the tech industry, and you think about Google and a lot of for-profit companies are already doing, and we want to bring that to bear in really important efforts like anti-human trafficking. And then using that information with our partners who are really the subject matter experts to develop data-driven, measurable, and regionally specific interventions or prevention efforts. So I'd first like to spend a little bit on the slide of building partnerships, because it is so core to who we are. We see those we serve in a broad range. It is both individuals who have experienced exploitation and experienced trafficking. It's organizations who are supporting those individuals. It could even be local and state government agencies providing services. So when we enter into a new geography, the first thing that we do, which is what Josie and I spent the last 6 months doing over Zoom in Alaska, is building relationships in the survivor community with those who have lived experience, with local nonprofits and community groups, for those who provide direct service offerings in their regions, and local and state agencies. And we see this not just as collaboration, but what we want is integrated collaboration, that we become dependent on one another, and we know that we cannot do our work, we cannot do this work without each other. The other interesting thing about building relationship, which is why I love that quote that I shared earlier about data is just a tool for enhancing intuition, is that actually in order to do these kind of the analytics that I'll share about in a minute, it is the expertise of the individuals living in that community that inform how the analytics are run. And so it really is about experience. It's about understanding and us asking questions and listening. And we have talked about holding some different listening sessions. We've tried to do that in one-on-one settings, and we have a couple other tools we'll share about at the end. So building the relationships is key for us to start. And then this analytics piece, and this is what I want to spend just a little bit of time on explaining. And so it's not just using data for data's sake, but it's really understanding root cause. Why is this happening? And so we use a couple terms for that root cause. It could be risk factor. Sometimes we prefer to use vulnerability. It's a little bit of a broader term because it's actually not just about individual experience. And we want to, and I'll introduce the socioecological model in a moment, but we want to make sure as we're thinking about what create the conditions for human trafficking to occur in a certain community, that there's not onus put on individuals, and it's certainly not individuals who have experienced exploitation. So when we talk about risk factors and vulnerabilities, we just talk about it as a characteristic that contributes to an event happening. And the more of those risk factors or vulnerabilities you have, the more likely it is that that event will occur. So it's a term that's used in a lot of different settings. We often talk about slip and falls of elderly individuals. the CDC has done a lot of research on the risk factors associated with that. So once we can identify what some of these risk factors or vulnerabilities are and use predictive analytics, which we'll talk about, that's what helps us understand what those root causes of human trafficking could be. And before I move further, Josie even spoke, and it goes back to that data is actually story. And so Josie shared the many stories that she had the honor of hearing and holding from youth experiencing homelessness and or trafficking at Covenant House. And what they kind of called out as a part of their history could definitely be considered a vulnerability. So this is a big fancy word in the public health space, which is not my background. So I have definitely stolen it from them, but they look at vulnerabilities across this spectrum. And they have done a lot of research in the public health space that if we identify risk factors and vulnerabilities across the spectrum, individual, relationship, community, and society, and build preventative efforts across that spectrum, that's when we see large scale social change. And that's really when we see impact and movement for a social issue. So when we think about individual, that could be individual experience. An individual risk factor could be the experience of, let's say, childhood maltreatment. Relationship, that's talking about all sorts of relationships. It could be peer groups, it could be romantic partners, it could be family or caregiver structure. Community, as it says, it's kind of your next broader component of where you live, your geographical community, as well as some of those relational components of community. And then society can be society and environmental. And that's when we start thinking about systems level change. That's when we start thinking about kind of systemic level oppression. And one of the things I think that Josie may talk about later or may bring up later is an example of what a risk factor could look like at the community level. Could be industry that is coming in. So for instance, in extractive industry coming into a community could increase the likelihood for trafficking to occur in that community. Society, again, as we think about some of the larger systemic issues around oppression and racism, those are risk factors and vulnerabilities. And when we start to layer those together and understand them better, we'll be able to understand the key drivers for why human trafficking occurs for different communities. So when we understand those risk factors and bring together the data, this is to get a little bit more specific about the data. This is the last data slide, I swear. But we want to use a tool called predictive analytics. And this is a case study. This is a study that was done specifically for suicide prevention in the Department of Veterans Affairs. And what the study was attempting to do is they wanted to reduce the number of individuals in their care who had become victims of suicide. And typically the way it happened in this setting, in this clinical setting at Department of Veterans Affairs, is the clinicians knew of some risk factors and would identify individuals who might be at risk. And so the researchers said, what if we have the same information that these clinicians do? We use their insights, we have some data, we build some predictive algorithms. What can we find out? And if you look at the bottom section there, you'll see that they found two really interesting things. Is not only were they able to identify more individuals who might be at risk, so able to potentially prevent suicide from more individuals, but they were also able to identify the higher risk individuals. And why that's important is there's a lot of these really big issues that we know of, like, as Josie had mentioned, poverty, or like systemic oppression, or potentially even, issues within the systems that we have. But in understanding what the higher risk is, now we know where we should put efforts. Now we know the highest priority efforts to prevent human trafficking from ever happening. And that's what this shows. That's what our hope is for both partnering with the local community, using data and predictive analytics. We can understand why human trafficking occurs and what those high risk factors are. So does it have to do, maybe with school lunches? That is not research-based. That is just, I made it up on the spot. So maybe it has to do with school lunches or park placement, or maybe it does have to do with some kind of deeper level, more systemic issues that need to be addressed. With that, we as a community now can come together. This isn't about prevention now, having improved resource allocation or building new and improved interventions. In fact, we don't want to build interventions. What we want to do is help translate this information to those community members that we're already in partnership with, who are doing amazing work, so that they can get the resource and funding they need, so that we can make sure that we're addressing what needs to be addressed and what's most effective for our communities. So bringing it back all together again, I would say our foundation is really these collaborative, integrated partnerships, using data to understand root cause of why human trafficking occurs and how that's regionally specific or community specific even. And then using that information, not just having information for information's sake, but using that information to actually drive action and change within a community. So that said, I would love to quickly share, Josie and I will quickly share. So Josie, please feel free to unmute if you're not already. I've lost you on the screen. Briefly share what this looks like. What does this even mean when we're coming into a new community or when we're working with a new community? And so over the last, I would say Josie and I began talking with people probably about 6 months ago, but have really started efforts in the last few months. And so our focus has been building relationships and understanding, again, what great work is already happening in Alaska in different communities, what individuals and agencies in different roles and with different experiences and lenses have seen. And then most recently, which I would love Josie to share both about some of the conversations we've had, as well as this tool. Just recently, we launched something called the DNA, the Data Needs Assessment. We actually call it the Human Trafficking Data Needs Assessment. It's the first time we've ever launched this. And we just asked our partners, our very new friends in Alaska, if they'd be willing to share some information about, where there might be data that could be used, how we could use that data, how it's currently being used, any barriers that there are to data collection. And we had over 140 different individuals respond to this survey. And so that's kind of our first gathering of data, gathering of information, just to understand what's happening so that we can help support our partners and help build or support whatever needs to be built as a first step. And then we can start collecting data, doing these amazing analytics and working with our partners to develop interventions. But first for us, we call it discovery or learning. We just like to come in and spend quite a bit of time learning from our partners. But Josie, do you have anything to add?
No, I just love hearing you talk about it. I get so excited. You guys can probably understand why the first time I talked with Kristen on the phone and heard about the model and what she was doing, I was like, Alaska, you need to come to Alaska. And it's because of what she said, because of our communities and our ability to collaborate with each other, and just the amazing work that's already been done in so many other sectors. I think Alaska is really unique in that way. Our rural communities are really unique, and our Indigenous communities are really unique to being able to do this type of work really well and thoughtfully. So I'm super excited about it. Like Kristen said, we expected maybe, I thought maybe 30 or 40 responses to the survey, like we were high hopes 50. So that was just another example of how willing people are to lean into this type of work and to give their time into collaboration and not have ownership of these individual ideas. I think our community is really special in that way. So I'm really excited to keep introducing Kristen to Alaska. We're going to be coming up there. I'm going to be going home, but she's going to be visiting Alaska soon next week. So I'm excited to share with her more about that. And then hopefully we'll be having a community event in the fall as well. So again, just really excited to share this. I think one thing that stands out to me is there's a lot of momentum in the anti-trafficking space right now in Alaska. And with that momentum, there's a lot of people who have the financial backing, the time, the motivation to do this work. And so I think it's just a really optimal time for us to do it together. This is work that's better done together.
Thank you so much, Josie. And I just want to say thank you again for giving us space today. I know we probably took the entire 25 minutes. We would have loved to connect with you for an hour and a half if we could have, but There is also my contact information on Prevention Now's website for anyone who's interested. We'd of course love to connect with you. And as Josie mentioned, I'll be in Anchorage in the next couple of weeks, but hopefully we'll be making regular trips so I can meet in person with individuals who are comfortable with that. With that, I will give it back to Ekpik.